How often should an older adult really shower? It seems like a simple question, but it turns out the answer isn't what most people think. If you're over 60 or caring for someone who is, you may have noticed something curious. The more you try to follow what you've always been taught about hygiene, the worse your skin feels. Drier, itchier, more prone to flaking, cracking, even infection. But what if everything you were taught about cleanliness, about needing to bathe every single day, wasn't actually designed for your body at this stage in life? That's the shocking truth we're diving into today. Because bathing in later years isn't just about habit, it's about safety, it's about dignity, and it's about protecting the skin and body you've worked so hard to care for all these decades. So grab a cup of tea, settle in, and let's gently unpack one of the most misunderstood self-care topics in senior health. How often should you shower now? Not when you were 30, but now that you're wise, seasoned, and a little more delicate. If you're new here, welcome to Elderly and Wise, your home for honest, compassionate, and empowering conversations for seniors and those who love them. Go ahead and tap that subscribe button, because the truth is, growing older doesn't mean fading away. It means living smarter, gentler, and with more grace than ever before. Now let's talk about the truth behind the shower curtain. Section 1. Daily showers are not designed for aging skin. Let's start with a bold truth. Daily showers were never designed with seniors in mind. In fact, they weren't even common until the 20th century, when advertising campaigns pushed soap and shampoo as daily essentials. These campaigns were aimed at younger, active people with oilier skin, not at older adults whose skin is naturally drier and more fragile. As we age, our body goes through dozens of physiological changes. One of the most important, the sebaceous glands, those little oil producers in our skin, slow down significantly. This natural oil, called sebum, is what keeps our skin soft, elastic, and protected from environmental damage. When we shower daily, especially with hot water and harsh soaps, we strip that oil away. And for seniors, that's like removing the very armor your skin needs to stay healthy. What happens when that armor is gone? Dry, flaky skin that feels tight and itchy. Micro tears and cracks, especially on hands, legs, and feet. Increased risk of skin infections due to weakened barriers. Eczema flare-ups, which are common in older adults. Chronic skin irritation that leads to rashes and sores. It's not just about comfort, it's about health. Plus, many seniors are already managing health conditions like diabetes or poor circulation that make skin problems even riskier. Combine that with bathroom safety hazards, slippery floors, high tubs, fatigue, and you've got a recipe for serious harm. So if you've been feeling guilty for skipping a daily shower, please stop. You're not being lazy. You're being smart. You're choosing to care for your body based on its current needs, not outdated routines. And your skin? It will thank you. Section 2. So, what's the ideal frequency? So what's the golden number? Most dermatologists and geriatricians agree. For seniors, 1 to 2 full showers per week is usually enough. That may sound shocking if you're used to bathing every single day, but unless you're heavily sweating, working out, or getting dirty, your body simply doesn't need it. This is especially true for those over 65 who live in mild climates, have limited mobility, or are managing dry skin. But there's a key phrase here: full showers. That means head to toe, under the stream washing. What we're not saying is to stop all hygiene in between. You can and should continue with daily hygiene routines that are gentle and safe. Washing your face each morning and night with a mild cleanser. Cleaning underarms and private areas daily with a washcloth or wipe. Brushing teeth twice a day. Washing hands regularly, especially before meals and after restroom use. These simple, targeted habits do more to keep you fresh and clean than a full shower every day ever could. Plus, showering less frequently gives your skin time to recover and build its natural defenses. Remember, your goal isn't to smell like a perfume ad, it's to stay healthy, comfortable, and confident in your skin. And that doesn't require water every day, it requires wisdom. Section 3, Hygiene without the shower, smart alternatives. Just because you're not stepping into a full shower every day doesn't mean your hygiene has to suffer. In fact, many seniors find that they feel cleaner, safer, and more comfortable when they use alternatives to daily bathing, methods that are easier on the skin and body, but still highly effective. Let's begin with the most traditional method, the sponge bath. This simple routine can be done right at the sink or bedside, using a soft washcloth and a basin of warm water. The key is to focus on the areas of the body that need the most attention: underarms, groin, feet, folds of the skin, behind the ears, and under the breasts. A gentle soap or cleanser can be used, but it's important to rinse and pat dry thoroughly. This method not only reduces the risk of slipping in the bathroom, but also protects delicate skin from the drying effects of hot water. Another excellent option is cleansing wipes made specifically for adults. These are especially helpful on days when energy is low or mobility is limited. Look for wipes that are free of alcohol, fragrances, and harsh chemicals, ingredients that can irritate older skin. Many of today's wipes are enriched with soothing ingredients like aloe vera, vitamin E, or chamomile, which cleanse and moisturize at the same time. They're perfect for freshening up in the morning, after meals, or before bedtime. For hair care, dry shampoo is a game changer. Washing hair in the shower can be both exhausting and risky, especially when dealing with slippery floors or limited range of motion. Dry shampoo works by absorbing oils at the scalp. Just spray or sprinkle it on, wait a minute, and then brush it out. It adds volume, removes odor, and keeps hair looking fresh until the next full wash. Some seniors go a full week or longer between wet shampoos and rely on dry shampoo to maintain that clean feeling in the meantime. If using the toilet becomes messy or uncomfortable, a bidet attachment can make all the difference. These affordable add-ons gently cleanse the area with a stream of water after each use, reducing the need for excessive wiping. Not only does this improve hygiene, but it also helps prevent skin breakdown and urinary tract infections. Many seniors report that installing a bidet has completely changed their confidence and comfort in the bathroom. Let's not forget the feet, an area that often gets neglected but can be a source of odor, infection, and discomfort. A soothing foot soak once a week, with warm water and perhaps a little Epsom salt, is not only relaxing but also promotes circulation. After soaking, it's important to dry the feet completely, especially between the toes, and apply a thick moisturizer to prevent cracks and fungal infections. Changing clothes daily is another quiet hero in the hygiene world. Wearing fresh undergarments, socks, and clean sleepwear prevents bacteria and body oils from lingering on the skin. It also makes sponge baths more effective by ensuring that the skin stays in contact with clean, dry fabric throughout the day. For areas of the body prone to moisture or friction, like under the breasts, beneath skin folds, or in the groin, consider using barrier creams, anti-chafing powders, or gentle moisture-wicking pads. These products help reduce the risk of rashes, fungal growth, and odor, especially in warm weather. The beauty of all these alternatives is that they give seniors the freedom to feel clean and dignified without putting their skin or safety at risk. Whether it's using a soft cloth and warm water or opting for modern tools like wipes and bidets, hygiene after 60 becomes less about daily routines and more about mindful care. Your skin deserves to feel respected, and your body deserves to feel comfortable. With the right tools and habits, you can stay just as fresh, if not fresher, than you did with daily showers. It's about working with your body, not against it. Section 4. The role of skincare. Don't skip the moisture. As we talk about showering less often, There's one non-negotiable part of senior hygiene that absolutely must be emphasized: moisturizing. For older adults, it's not optional, it's essential. Aging skin is fundamentally different from younger skin. As we grow older, our sebaceous glands slow down, meaning they produce less of the natural oils that once kept our skin soft and resilient. At the same time, the skin itself becomes thinner and more fragile. That means it loses moisture faster and is more vulnerable to cracking, itching, and infection. And if you're showering, especially with hot water or using soaps that are too harsh, you're removing whatever little oil your skin is still producing. Without proper hydration, the skin becomes dry, tight, and uncomfortable. Worse, tiny cracks can form. Those cracks are doorways for bacteria, leading to infections, especially in areas like the legs, feet, and hands. That's why moisturizing is just as important as bathing, maybe even more important. After any kind of washing, whether a full shower, a sponge bath, or even just cleaning your face or feet, apply a rich, fragrance-free moisturizer while your skin is still damp. This helps lock in moisture and protects the skin barrier. It's also important to choose the right type of moisturizer. Lotions are the thinnest and usually contain more water, which makes them easier to spread, but they evaporate quickly. Creams are thicker and more protective, making them a better choice for overnight hydration. And ointments, like petroleum jelly, form a strong barrier that seals in moisture and prevents skin from drying out altogether. While they can feel greasy, they're excellent for very dry spots like elbows, knees, or cracked heels. When shopping for a moisturizer, look at the ingredients. Choose products with ceramides, glycerin, hyaluronic acid, or shea butter. These ingredients help draw moisture into the skin and keep it there. Avoid anything with alcohol, artificial fragrances, or anti-aging acids. Those can irritate senior skin and do more harm than good. It's not just about what you put on your skin, but when and how you do it. Always apply moisturizer within 5 minutes of drying off from a shower or sponge bath. And don't skip days. Moisturize at least twice daily, once in the morning and again before bed, focusing on the hands, arms, legs, and feet. If your skin feels tight, flaky, or itchy, that's a signal that it's thirsty. Feed it with care. Another overlooked tip is to maintain a comfortable humidity level in your living space. Dry indoor air, especially during winter, pulls moisture from the skin. Using a humidifier in your bedroom can help restore moisture to the air and, in turn, to your skin. You can also wear soft cotton socks or gloves at night after applying lotion to your hands and feet. This not only improves absorption, but protects your bedding and helps prevent moisture loss while you sleep. Sun protection also plays a role. Even if you're not outside much, the sun's rays can damage aging skin quickly. Use a moisturizer with SPF 30 on your face and hands daily if you're exposed to sunlight through windows or while walking outdoors. Ultimately, your skin is your body's first line of defense. It deserves protection, and that protection doesn't come from overwashing. It comes from nourishing, hydrating, and respecting the skin you're in. Think of moisturizing not as vanity, but as medicine. It's a daily dose of comfort, healing, and self-care. Section 5. When you should shower more frequently. Now, while showering just once or twice a week works well for most older adults, it's important to recognize that there are certain situations when more frequent bathing is not only appropriate, it's necessary. Let's begin with physical activity. If you're a senior who exercises regularly, maybe you enjoy brisk walks, gardening, dancing, or stretching in the morning sun, you may sweat more than others. And when the body sweats, it naturally builds up bacteria, especially in warm, moist areas like the underarms, groin, and under the breasts. In cases like this, a full body shower every couple of days may be a better choice for comfort and hygiene. The goal is to rinse away sweat, reduce odor, and prevent rashes or fungal growth before they start. Then there's incontinence. For seniors dealing with urinary or fecal incontinence, whether occasional or chronic, hygiene becomes a vital health concern. It's not just about odor or cleanliness. When waste stays in contact with the skin, even briefly, it can lead to serious irritation, skin breakdown, or infection. In these cases, thorough cleaning of the affected area after each accident is crucial. This may not always mean a full body shower, but the perineal area needs to be cleaned with gentle, warm water in a soft cloth or specially formulated wipes. And sometimes a quick shower may be the safest and most effective way to reset and feel clean again. We also need to talk about skin conditions. Some seniors experience chronic or acute skin issues like eczema, psoriasis, or fungal infections. These conditions often require more frequent bathing to manage symptoms or apply medicated treatments. Similarly, if you have open wounds, diabetic ulcers, or pressure sores, your doctor or nurse may recommend bathing more regularly to maintain a clean environment and prevent further complications. In these instances, you should always follow the care plan provided by your healthcare professional. Another important consideration is illness. If you've had the flu, gastrointestinal upset, or any kind of infection, bathing may help reduce the spread of bacteria and support your recovery. Even something as simple as cleaning off after a visit to a crowded clinic, public transportation, or physical therapy session might call for a shower that evening. Your immune system may be more vulnerable with age, so staying clean, especially during cold and flu season, can play a role in staying well. Sometimes the need to shower more often isn't about physical condition at all. It's about emotional well-being. If you've had a tough day, if your mind feels clouded, or if you're struggling with sadness or anxiety, stepping into warm water can be a gentle act of comfort. A warm shower can calm the nervous system, ease sore muscles, and offer a moment of peace in an otherwise stressful day. Never underestimate the healing power of water, not just on the skin, but on the spirit. That said, even when more frequent bathing is needed, it must be done carefully to avoid harming the skin or increasing fall risk. Always use lukewarm water, not hot, because hot water strips away natural oils. Keep showers brief, ideally under 10 minutes. Use a mild, fragrance-free cleanser that's designed for sensitive skin, and make sure you moisturize immediately afterward to replenish lost hydration. Also, consider your bathroom setup. More frequent showers mean more exposure to slippery surfaces. Install non-slip mats, a shower chair, handheld sprayers, and grab bars if you haven't already. These modifications don't just make bathing safer, they make it more comfortable and dignified. Remember, bathing frequency should never be based on guilt or social pressure. It should be based on need. If your lifestyle or medical condition calls for more showers, then by all means take them. But take them with care. Protect your skin, respect your energy levels, and create a routine that supports, not exhausts, you. A clean body is a wonderful thing, but a clean body cared for gently, with understanding and intention, that's the true goal. Section 6. The emotional side of bathing. Dignity, autonomy, and trust. Bathing may seem like a routine task, just another part of daily self-care. But for many older adults, it's something much deeper. It's a moment that stirs feelings not often spoken aloud. Vulnerability, frustration, embarrassment, and sometimes even grief. Because the truth is, needing help to bathe can feel like losing a part of yourself. For those who have spent a lifetime working, raising families, and being the ones who provided care to others, the idea of needing assistance to do something as personal as showering can feel like a loss of independence. The bathroom, once a place of privacy and routine, can suddenly feel like a stage where dignity is on the line. It can be hard to say the words, "I need help," and even harder to accept the help with grace. But here's something every senior needs to hear. Needing help does not diminish your worth. It does not mean you're broken or helpless. It means your body has changed, yes, but your spirit, your experience, and your dignity remain intact. Reaching out for support is not a sign of weakness, it's a sign of wisdom. It shows you understand your limits and that you value your safety and well-being enough to adapt to what this stage of life requires. At the same time, for caregivers, assisting a loved one with bathing is a sacred responsibility. It's not just about cleanliness, it's about maintaining trust and preserving the emotional bond that connects you. The way a caregiver approaches bathing can have a profound impact on how the person receiving help feels about themselves. Speaking gently, involving the person in decisions about how and when they want to bathe, and explaining each step before doing it, these small gestures go a long way in making someone feel seen, heard, and respected. Maintaining a sense of autonomy, even in small ways, can restore dignity in the bathing process. When possible, allow the senior to wash parts of their body themselves, even if it's just their face or hands. Offer choices whenever you can, such as picking the time of day or the products used. Allow for pauses. Ask for feedback. These moments of shared care are not just practical, they are deeply emotional, often tender, and can build trust that extends beyond the bathroom. For seniors, there's also the emotional challenge of adjusting to these new realities. It may take time to feel comfortable receiving help. You may grieve the independence you once had. That's okay. Those feelings are valid, but in the midst of them, try to remember that dignity is not lost when someone helps you. It's lost when you are made to feel invisible, rushed, or disrespected. And that's why creating safe, respectful bathing experiences, either independently or with help, is so important. Bathing at its best should not be something to dread. It should be something that leaves you feeling refreshed, calm, and restored. It should be an act of care, not just for the body, but for the soul. And whether you are caring for yourself or someone you love, approaching hygiene with kindness, patience, and understanding can transform the experience from something clinical into something beautiful. Because at the heart of it, bathing is not just about getting clean. It's about feeling whole, feeling human, feeling like yourself even when things are changing. And that, more than anything, is worth preserving. Final thoughts on cleanliness, comfort, and self-respect. So how often should seniors really shower? The honest answer is, it depends on your body, your lifestyle, and your needs. For many older adults, showering just once or twice a week is perfectly healthy, especially when paired with gentle, daily hygiene habits and proper skincare. What matters most isn't how often you bathe, but how kindly you treat your body in the process. If this video helped you rethink your routine or gave you peace of mind, we'd love to hear from you. Drop a comment below and share your thoughts or personal tips. You never know who you might help by speaking up. And if you're not already part of our community, be sure to subscribe to Elderly and Wise for more honest, thoughtful conversations about aging with dignity and care. Thanks for watching. Until next time, stay clean, stay safe, and above all, stay kind to yourself. Love.